Hi everybody, I'm Lisa Swanson. I'm a dermatologist and pediatric dermatologist in Boise, Idaho, land of potatoes. I work in private practice at Ada West Dermatology and I'm affiliated with St. Luke's Children's Hospital. I'm here in beautiful San Diego that we all know and love from Anchorman. And I'm here for the Elevate West conference. It's going to be a blast. We have a whole afternoon devoted to JAK inhibitors and our love of JAK. From my sessions here at Elevate Derm, I have learned and hopefully imparted knowledge to the group that the JAKs are here to stay and they are fantastic. They offer a potential for wellness that we have never seen before for difficult to treat conditions like atopic dermatitis, alopecia areata, and in the future, vitiligo and hidradenitis suppurativa. So the JAKs are here and we're excited. Recent data impacts my clinic decisions all the time. I'm always reading my journals, looking for tips and tricks to help me in clinic with my patients. One of the biggest take-homes that I've been gathering is that we need to be introducing oral JAK inhibitors for our patients with alopecia areata earlier. We're saving them, we're tucking them away, we're waiting for situations where things are really, really bad. We need to stop doing that. We need to be talking about them earlier on. We get better efficacy, and I think in some cases, we can even turn it off. And a patient could have a chance down the road of coming off their JAK inhibitor and maintaining their hair. So we need to be intervening earlier to attack the alopecia areata. I think any patient with moderate to severe atopic dermatitis or severe alopecia areata is a candidate for a JAK inhibitor as long as their age meets the indication for the condition and the particular medication. I think we need to not be afraid of these medicines because they really offer so much for our patients and their families. There are a few situations where I might be a little more hesitant with a JAK inhibitor and might have a longer, more in-depth conversation with the patient and their family. And I call them the 3 C's. Cigarettes, if a patient is a smoker or has been a smoker. Number 2, clots, if they've ever had a blood clot, what was the story behind that? And number 3, conception. If they're a female of childbearing potential, what are their family planning goals? Are they anticipating a pregnancy? If so, we should wait on the JAK inhibitor. So those are the things that I think about as I assess a patient to determine if they're a great candidate for a JAK or maybe a less great candidate for a JAK. Anyone that's new to prescribing JAK inhibitors or anybody who's a little bit JAK afraid, I recommend starting with an alopecia areata patient for a couple different reasons. Number 1, treating alopecia areata patients with oral JAK inhibitors is going to change the lives of everybody involved. Your patient, for sure. Their family, definitely. But also for the prescriber. It's really wonderful to see these patients march through this journey on their oral JAK inhibitor, regrow their hair, regain their confidence. It's amazing. The second reason I would start with an alopecia areata patient is because I kind of joke that you could read the contents of the entirety of the boxed warning verbatim in an ominous tone to a patient with severe alopecia areata, and at the end of that, they would say, okay, can we start today? So if you're JAK afraid, this is a motivated patient population where you can do a lot of good and you can kind of get your sea legs with JAK inhibitors by treating alopecia areata patients.